Hello everyone, welcome to my channel, and in today's video we are going to discuss how to pick up cues in a consultation. So in PLAB 2 exam, when you're preparing for your exam, a lot of people tell you you should never ignore cues and you should always pick up cues and respond to them, and it will improve your IPS and it will improve your score. So we are going to take a detailed look into what cue actually means and how we are supposed to pick them up and respond to them. Okay, but first of all, I want to discuss what happens with us when we enter that cubicle in our PLAB 2 exam. So when we enter the cubicle, we have this time limited consultation on our mind. So we are thinking that I have 8 minutes to finish the task. And as we have read a lot for the exam, we have read all the notes, we have practiced a lot, we have developed this checklist in our mind. And as soon as the patient give us their presenting complaint, we start ticking the boxes and we start asking the questions from our checklist. Okay. So we want to arrive at a diagnosis and we want to explain the diagnosis to the patient. And when we have done that, we think, okay, so I have asked everything, I have explained everything, and I've completed the task. But in reality, we have totally lost the sight of the person that was in front of us. Okay. The patient. The patient might also have their own objectives. So this is basically our agenda and our objective. And this is the patient's objective. And if we keep following our checklist, we might not be able to touch any of the patient's agenda at any point in time in our consultation. Okay. So the patient agenda can be any concerns, any worries that they are seeking explanation or reassurance for. There might be some expectations for certain medicines to be prescribed, certain tests to be ordered. And while it's one thing to ask ideas, concerns, and expectations in the ICE part of our consultation, the patient might be dropping clues here and there in the data gathering part. And when we are following our checklist, what can happen is the patient might give us some emotional statement and we will totally ignore it, thinking that, okay, I will address ideas, concerns, and expectation in the I spot. So, for example, if a patient is chest pain and the patient tells you, doctor, I'm having this chest pain and it scares me a lot. Okay. And we are thinking about our own checklist. So we will ask the patient, okay, so can you please tell me more about this chest pain? So the problem here is the patient will tell you about their chest pain, but he will feel that as if you are not actually listening to him. You are not validating their concerns or their emotion. And the examiner will also mark you down in the listening part. Okay. And they will also mark you down in your IPS. So how to actually respond to these concerns or these cues in the data gathering part. So first of all, you acknowledge their concern or their worry and reflect on it. So what you can do is you can tell them it's understandable that it is understandable to be scared. But can you please tell me what is it about this pain that worries you so much? Okay. So you ask that question. You actually, first of all, you acknowledge their concern or their worry or their expectation or their emotional statement, their emotional state, whatever cue that they are dropping, you first of all acknowledge it. Okay. You tell them that you mentioned that you are worried. Okay. And then it's understandable to feel that way. And then ask a question. Can you please tell me, or can you please explain it to me, or can you please describe it to me? So one of these questions. Okay. And then move forward with your consultation, ask your next question, whatever the next question that you want to ask, whether that is the duration of the pain, the site of the pain, whatever. And you keep moving in a unidirectional manner, touching both your agenda and the patient's agenda, okay? And take your consultation forward like that. So it will be much more smoother, okay? And it will be much less robotic. So I hope this is clear, and now we will discuss different type of cues. So cues can be both verbal and non-verbal, okay? So first of all, let's take a look into verbal cues. So verbal cues can be statements of emotional significance, or they can be certain vague statement, and the patient might be looking for you to explore their statement further. Okay, so it can be emotional statement like I'm scared, it worries me a lot, am I going to die? So as I've already discussed, first of all, you need to acknowledge their emotional state. You need to reflect on it. and you need to explore further. Sometimes patient asks you questions like, am I going to die? Okay, so here the patient is not actually, they are seeking some emotional comfort. They're not seeking a matter of fact answer. Okay, for example, if a patient comes to you in an emergency like myocardial infarction, you don't know whether the patient is going to die, so you can't give a matter of fact answer to this. But what you can do is you can tell them, you can provide them some comfort, you can reflect, you can validate their emotional state. You can tell them that I understand that it must be scary, but the important thing is that you are in the hospital, and we are going to start you on treatment, and we are going to take really good care of you. Okay, so any emotional statement, validate their emotion, reflect on them, and explore them further by asking questions like tell me, explain, and describe, and take your consultation forward from that. Okay, sometimes they give you vague statement like I have problems, it feels worse, I don't like doctors or hospitals. So you need to validate them again. I have problems. So you tell them, you mentioned that you have problems. Would you like to explain them further to me? Okay, can you please describe your problems to me? Okay, it feels worse. You mentioned that you feel worse. Can you please explain it to me? How does it feel worse? Okay, I don't like doctors or hospital. You can say, um, I understand you might not be feeling comfortable here in the hospital, but can you please explain it to me? What is it about the doctor or the hospital that you don't like? And what is it that we can do to make you feel more comfortable? Okay. Now, cues can be nonverbal. A lot of the time, they are nonverbal cues. So, facial expression. So, a patient presenting with headache or chest pain can be looking distressed. Okay, and you can't just you enter the station, the patient is giving you facial expression of pain, and you just ignore that and you ask them, "How can I help you?" Okay, so it doesn't look nice that the patient is sitting there and they are clearly in pain, and you just ask them, "How can I help you?" And the patient feels like you are not actually looking at them. Okay, you are not actually seeing them as a person, and the examiner also notices it. So instead of that, you can say, I notice you seem uncomfortable. Are you in pain right now? The patient say yes, then explore the pain further. Tone of voice can be a non-verbal cue. So the voice can be low, it can be elated. For example, a patient with mania. Okay, depressed patient can be low, the voice can be shaky in an anxious patient. So if the voice is, for example, shaky, you can say, you sound like you are really anxious or you are really worried. Is there anything that is bothering you? Okay, so you have actually acknowledged their state of anxiety, you have reflected on it, and you have asked an exploring question, and you are trying to explore the cause of their anxiety. And if there's like, if you find a cause, then you are going to, tell them that, okay, we can do this to make you feel better. Now, patient can also convey nonverbal cues with their body language. So, for example, the patient can convey pain by holding a body part. For example, a patient is touching their stomach, okay, and they have pain expression. So you can say, I can see that you are holding your stomach. Are you experiencing pain there right now? Okay, and then explore the pain further. If the patient is appearing depressed, so a depressed patient will have a body language of not giving, avoiding eye contact, and looking down, low and monotonous tone of voice, downcast expression, and they may be like sitting slumped in their chair. So what you can do, what you can do for them to know that you have acknowledged their state, that they are feeling low, you can tell them that you seem quite down today. Um, how have you been feeling emotionally? Okay. So if they tell you like just feeling really low recently, so what you can do, you can sympathize with them. I'm sorry to hear that. Can you please tell me a bit more about this feeling? So you can see that we are like constantly telling them that I'm seeing you, I'm hearing you, I am validating your emotion, and I'm exploring further your emotion, or your concern to see how can I help you. Okay. So A patient can be like, you can encounter a patient who is anxious and they are appearing restless, or they're constantly fidgeting, moving their hands, arms, looking here and there. So you can tell them, you seem a bit anxious. Is there something that you are worried about? Okay. And if there's something, if they say, I'm just nervous, I don't like coming to the hospital. Then you can like acknowledge their emotion. You can tell them it is understandable to be nervous in a hospital. Can you please tell me a bit more about how you are feeling at the moment, and what can I do to make you feel better? For example, if they are nervous about their test results, you can say it is understandable to be nervous. Is there anything particular on your mind about the test result? We can explore we can go through the test results together to see what the test results mean and what we are going to do further for you. Okay. Sometimes the patient can appear reluctant or defensive, especially if they are against their will. They're there against their will. Can be a psychiatric patient, so you can tell them, you seem a bit hesitant. Is there something that's making you uncomfortable? Okay, and if they tell you something, then you reflect on it further and explore it further. Find out how you can help them in the best possible way. So this was all about exploring cues, validating them, responding to them. And if you do this in your exam, I'm sure that it will have a very positive impact on your IPS and your total score. I hope it was helpful, and I'll see you soon in the next video.